Here in Shirati, Tanzania, it doesn't take long for the morning sun to heat up the region. The temperature, the dust, the bugs, and absence of running water have all become part of the routine for the Northwestern University students here. But you won't hear them complain. Though not doctors just yet, they understand that they have a job to do. After a quick breakfast, the students begin their journey. They're heading to Rao Hospital. It's about a mile from their lodging, but the students are eager to arrive.
We were really surprised the first day to see an announcement for us, and in the announcement they called us Northwestern experts. A lot of the patients that we're seeing this week are here coming in because of us.
The Tanzanian people have been beyond just grateful, and it reflects in the way the patients respond to you. So I think that's been the most rewarding part of it, is just seeing them light up at the end of a conversation, be like, you fixed my problem even though I haven't had this fixed in 5 years, We're strangers to them and we're foreigners, and they greet us with open arms, I think, which is always very telling.
Bringing the students to Shirati was the work of Dr. Phineas Makoyo and his wife Leah, who built Rao from the ground up. Establishing the relationship with Northwestern began after Leah received treatment for breast cancer at Northwestern hospitals in 2013. So impressed with the care that she received there, she was determined to bring that level of treatment to Tanzania.
I just felt that I was so fortunate that I have that opportunity, but I have so many people back in Tanzania who do not have that. I think I was just sick so that other women back home can have a solution to this.
That was where the Global Health Initiative stepped in. In an effort to support healthcare in Tanzania, they partnered with Rao Hospital, allowing for Northwestern students to travel to Shirati and practice alongside Dr. Makoyo and his staff. The program offers students a rare opportunity to experience medicine in a way they might never see otherwise.
It really is our only ability to kind of get out in the world and experience medicine as we would never see it. I mean, we learn medicine in the States where you have a chief complaint, you want to order this test, you're going to get this imaging, and then it's almost an easy algorithm to follow thereafter when you can get those things, right? It's really actually essential to be able to not have that be a crutch. Clinical exam skills, better history taking.
How often are you having these episodes where the pain or numbness?
These are the things ultimately that makes her a better physician.
In addition to attending to and treating patients, the students have been given the chance to teach breast cancer examinations to Tanzanian students, demonstrating the proper technique to the future clinicians.
Programs like this, you can really see the visible benefit on both ends. I mean, obviously, we're benefiting from the funding that, brought us here. We're being of help just by being an extra set of hands a lot of the time. I think I've learned just as much here as I would on any clinical rotation at Northwestern.
On the other side of the continent, one man is already making an impact in a similar community. Here in Liberia, Northwestern Dr. Adam Murphy is working on cancer research.
So I'm a prostate cancer disparities researcher and urologist. And so what I expected to do is do prostate cancer kind of education, maybe do some prostate cancer surgeries.
As expected, Dr. Murphy notices glaring differences in healthcare offered in Liberia as opposed to what we're accustomed to back home.
So what really kind of stuck out for us was there were no urologists in the entire country, none. And so it just changed my focus, more from kind of a let me deal with this one disease to kind of a really broad sense of education and training that needed to happen around basic urologic care.
Beginning that education and training was more difficult than he had hoped for.
None of the equipment that we needed to do the basic procedures was still functional. That we had to not only come and do the medical mission, but we also had to become a supplier of urologic equipment. The Global Health Initiative in Northwestern had been doing this work before. And what they were able to do for us was to tell us how to get these equipment needs met. They provided funds and contacts with this organization called Project Cure.
So Project Cure is the world's largest distributor of donated medical equipment and supplies. All of it is customized based on our on-site needs assessment, so we understand exactly what they need, and we then marry up that need.
To meet those needs, Northwestern students volunteer their time to load up large shipping containers, packing them wall to wall with the necessary supplies. Through Project Cure's partnership with the GHI Fund, Dr. Murphy was able to get the critical equipment he needed in Liberia. Back in Sharati, Rao Hospital was also the recipient of a Project Cure container, receiving much-needed supplies, along with 40 boxes of medical books donated through a student book drive.
A lot of the stuff we sent is very much needed. What they've done with our books, I mean, books that, I would sell to an Uprising M1, they're able to teach a whole classroom with here.
The container has been very, very helpful. It has really uplifted what we have. The school, we didn't have any books for school. Now students are so happy.
Looking forward, Northwestern and the Global Health Initiative seek to continue their relationship with Rao Hospital, expanding their cancer treatment program and serving as a model for future work with healthcare facilities around the world.
I believe that it will get us somewhere, because I believe that something can be built on top of this foundation that we have made.
So much can be said for what the students do overseas. But what about those who elect to help out close to home? Here on the west side of Chicago, the PCC Community Wellness Center provides personalized care to local residents in the Austin neighborhood.
What's different about PCC Community Wellness Center is that we are stationed in the community, so we want to be available for our neighbors and our community members here.
I've been taking care of your brother and sister for years.
We give very individualized care. We prescribe care centered around you.
Over the years, the partnership among Northwestern, the Global Health Initiative, and the PCC Community Wellness Center has grown. The program allows for Northwestern students to come and work in the clinic over a 4-year period, gaining valuable insight into long-term patient care.
So the Education-Centered Medical Home was dreamed up as an opportunity to allow the students to get early introductions to patient care.
About 6 years ago, I believe we expanded to this new ECMH program, really to emphasize primary care and its importance and to help students enrich their learning experience. And ours, we've loved having them.
Obviously this is a great learning opportunity. We don't really often have any scenarios throughout med school otherwise to see practice continuity care, where we get to see patients over a longer period of time and really follow with them and really kind of experience what that part of patient care is like.
As the GHI continues to extend its global reach, our medical students have been joined by dedicated Northwestern residents and faculty. Together they have touched the lives of thousands of sick and suffering people, providing care, conducting research, delivering supplies, all while learning valuable lessons in medicine and humanity. The Global Health Initiative. Together, we make a world of difference.